you all were in there, you just heard there is a great deal of opposition to this new finger scanning policy. And the reasons are multiple. They go from the operational problems to the privacy concerns to the concerns about how the money was used for this, taken from what could have been services directly to children. Many, many concerns. One thing that hasn't been stated exactly this way up to this point, but I do think it's important to say that one of the concerns about this is that it is excessive regulation of small business. These are small child care businesses that are trying to keep their heads above water. And I do want to underscore one of the points one of the child care providers made about the large number of occasions when child care centers provide services to children that they never get paid for. The way this voucher program works, providers provide the service, and parents have to have their vouchers active. Those vouchers have to be reactivated every year. There's lots of paperwork associated with that. All while that's happening, the providers continue to serve those children, and sometimes they get paid and sometimes they don't. So this set of providers is not a set of providers where there is a rampant problem with fraud that a program like this needs to be enacted to address. What we need in the program is to have a state agency that's working as hard as possible to find every penny available to serve more children. Because we've got too many on the waiting list, we've got too many unserved, we've got too many providers that are going out of business because they can't keep their heads above water financially, and we've got too many requirements being imposed on these providers to improve quality without the revenue to finance that. And in that scenario, for us to be imposing a requirement that is going to erode revenue is going the wrong direction.
Okay, I'm Sue Harvey, and I represent the southwestern part of Adams County, and I've been in business 38 and a half years, since 1973, and licensed in 74, one of the first to ever be licensed, and I know where it's all started and where it came from the bottom up. I think the first license was in 1972. So I know when I've been in and out, I know the ups and downs, child care, but I love it, or I still wouldn't be in it. About this fingerprinting, I think it's very discriminating against a lot of people. I don't like it. I think it's funds that are absolutely tax dollars, call it what you will, that's going, it's just not, they're not prepared for this. Technology's great, but this isn't the time. They just took over the certificate program. When I say they, Human Services. And it's not even perfected yet. They're getting there, and they were getting there, and then they sprung this on us. And I don't approve of that. And someone brought up in the meeting about the other children. You know, they see these children get fingerprinted and scanned and that sort of thing. You know, how are they going to feel? Why are they doing this? Why am I not doing this? I think we need to look at the whole picture here. It's not just dollars and cents. It's about the children. It's about how they feel, and it's about the parents. Yes, it's a lot of work on us. You know, and I'm used to work. I'm used to staying up till 8:30, 10 o'clock, sometimes 11 o'clock at my business. Been doing it too long. But I'm one that can do what I have to do. I don't have a problem with that. Do I like it? I do not like it. I want to see the money going to the children. I want to see parents out working, going to school, and it implemented and absolutely used for these children. And that's what it's all about. It's not about anything else.
I'm Bill Chandler, Executive Director of the Mississippi Immigrant Rights Alliance. For the last 12 years, we've had this organization, and we've been dealing with migrant families. But long before that, I've been involved with low-income workers, whether it's farm workers, health care workers, providers, and public workers. And over the years, one of the major problems that those workers have as finding child care. And by making it harder for people to provide child care or to actually access child care, I think is criminal. And I think this needs to be reversed. I think we need to get more money into early childhood development. You know, not only for the people that are using it now, but there's plenty of children that are children of immigrants that should have access to these programs, and parents that should have access to child care. And doing things that keep people from benefits that they pay for as taxpayers, like they've done with TANF and lots of other programs, you know, I think is terrible. And I think that needs to be reversed. And we stand here in solidarity with the group of parents and providers to support their effort to turn this back.
Hi, I'm Carolyn Todd, and I represent the northern part of the state. I'm from Senatobia, Mississippi, which is in Tate County, probably only about 10 miles from DeSoto County. We started our center about 18 years ago, and the vision there was to target low-income families and to help the children from low-income families have a better chance at early childhood. This system, we've struggled with the Plan and Development District. We did not have a easy time with the Plan and Development District in our area, and thought that with DHS taking over the funding again, that we would it would open the way for more children to families to be served under this program. But I think that with the fingerprinting program, it's just so much that we do not know. I have families, I have parents who are asking all kinds of questions that I can't answer. And today, leaving here, I don't feel I can answer anything still. So I keep telling my parents to hold on, and we'll see, you know, maybe we'll get answers later. But I don't think I got any answers here. But I don't think that they thought this plan through, and I just don't think that they're working in the best interest of the children and the low-income families in their children.
My name is Albert Butler. I'm the state senator for the 36th district, and also I serve as chairman of state investigative affairs. In this, we will find that I'm the new kid on the block as well, and the things that I've heard from the child care providers, it is something that we need to look into. And being assigned this position, one of the things that the Lieutenant Governor said to me is that Senator Butler, we want to make sure that we make government more transparent for the people. And our objective is to make it more transparent. And looking at the things that are happening to our children today, we do understand the lack of understanding with the parents. And we do intend to work to try to make these things easier for everyone. We know child care plays a major part in the education of the state of Mississippi. If we're going to bring Mississippi up, we must start at the early ages, and we intend to work with them to try to make that happen.
Do we have any questions?
Senator Butler, exactly what do you intend to do?
Meet with the committee and have the committee to request from DHS the questions that was asked today. And after they submit the questions to us, we will study those questions and then get back with DHS about possible solutions to the problem.
Have you had any substantive discussions with anyone at DHS over this at this point?
Yes, we have.
Who have you talked to?
I've talked to the director himself, and I've also talked to Dr. Dent.
Is it your understanding it's too late to reverse the contract, or?
I can't answer that at this time.
Is that something you're going to look at, or?
That's something that we will look into.
Are you considering legislation for the next year?
We have discussed that, and that was one of the reasons we have been having committee meetings so that we can gather information. If there's a need for a change in legislation, we can prepare for that.
And nobody's I haven't had any, I've gotten a lot of different numbers. Can you tell me how much money the state spent on this program?
No, I cannot.
Who would be able to tell me that?
I can.
You can, okay. Numbers are fun, come on.
Well, there is an invoice that shows they have committed 12.9 million, I think it's 12.9, over a 5-year period. They've purchased hardware already, and that expenditure is between $1 and $2 million, and it's already been expended. But the contract that they've signed, the money they've committed, is between $12 and $13 million.
Ms. Bernette, it's true that the hardware was purchased using federal stimulus money by the Barber administration, isn't it?
It was federal child care money. I can't.
Is it federal child care money?
Yes, the child care program received some additional funding as a result of the stimulus package in 2009, but it wasn't a separate funding stream. It was just additional child care money that came to the state as a result of the stimulus package. And the purchase was made subsequent to 2009. So the child care block grant includes multiple different sub-grants to it, so I don't know which sub-grant out of all of the CCDF funds that Mississippi had, DHS chose to use to purchase the money, but it was federal child care money that was used.
Are other states doing this?
Louisiana is the only other state.
And what's their, I don't know, what's the impact been on them?
The impact in Louisiana has been that they have saved money, and the agency that's implementing it says they've saved money because parents have been deterred from applying, and the payment to providers has been tightened down to just the time and attendance the children have actually had in the centers.
Is there any type of federal guidelines on, I mean, is this something the federal government sanctions or you understand my question?
There are no federal guidelines about creating an electronic system or a tracking of time and attendance, if that's your question.
And is this something that they might not approve of, or?
There's unfortunately no federal approval process in the federal block granting system. The state only has to submit a state plan once every 2 years that says to HHS how they plan to implement the program. But as long as they submit the plan by the deadline, they're in compliance. There's no internal HHS approval process to say we approve what you've said you're going to do, or we disapprove what you've said you're going to do.
So it's not like Medicaid where if the state makes some changes that it has to have a waiver to do that.
That's correct.
Yeah.
That's correct.
But DHS, of course, says this just makes sure that we're only paying for children that are there on that day and not wasting money for children that are sitting at home. But is that flawed?
That is the goal, as DHS describes it, and none of us are opposed to fiscal accountability. The challenge is that in a child care center, if you've got a class of 12 children and 2 of them happen to be sick today, that child care center still has to have the same number of staff that day that they pay wages to. And they still have to have that same learning center, whether they're 10, 11, 12, 9 children who happen to be in attendance that day. And so the a la carte payment, or the shrinking the payment down to who happens to be there now, is opposite what DHS also says, which is that we want to create learning infrastructures in these child care centers. You can't have it both ways. If that's what you want, you need to finance it. And if what you're going to pay for is 50% of the market rate for child care, only the times the child is present, for only 15% of the families who qualify, then you're not going to finance a quality early education system.
Refresh my memory, how many kids are in the voucher program right now?
DHS reports as of August the 12th, there were 19,500 children on the Child Care Certificate Program. And I'd just like to point out that's a drop from 2011, where there were about 45,000 kids in the program.
And that's from the loss of those stimulus dollars, right?
The stimulus dollars were lost before. Those losses cannot be explained by the stimulus money that went away long enough ago that it doesn't impact the federal fiscal year 2012 numbers. And the other thing is, DHS says they've only spent $30 million in federal fiscal year 2012. The federal block grant to Mississippi was $55 million. So where is the other $20 million, and why hasn't that been drawn down by the state? Or if it has, why hasn't it been spent on children?
So what's the waiting list, do you know?
8,050. Yeah, that's just the ones that have gotten their application in to be on the waiting list.
One big concern is that with the implementation of these procedures, many children will be denied access, and that is a violation of the regulation. Children are to be afforded the opportunity to child care. Parents should have a right to choose the centers that they wish. And at this time, many providers, especially church providers, have already sent out letters to say they will no longer provide these services for these children. For instance, if you have children in a rural area, this may be the only place that they can go. Therefore, that would leave the children with nowhere to go. And I've been talking with various ones, and this is going to be the problem, that they will not serve them. They may have boards or for whatever reason. They're going to deny that access.
And are you of the opinion that it's going to put some centers out of business?
Oh, yes. It's going to put centers out of business. I think that's one of the objectives, because they've issued so many certificates to so many small daycare centers. And this may be eating up some of the money. So the rationale is, if we come up with policies that we could exclude many, then we would be able to recoup some of the money. But why not ask the planning board to not allow all these small centers to go where they shouldn't be, and make sure that they spread it out?
So what should the state do to help child care providers like yourself?
I think they, first of all, need to sit down with us and find out more about what we do. Many of them don't understand our plight. They may have worked in a center, but they have not led the chore of actually being what we do. Because sometimes we're the lawyer, sometimes we're the social worker. They may have just worked in a setting where they didn't have those problems, especially when you're working with poor children. There are legal problems, social problems, there are dress problems. We have to dress children, we have to bathe children. So there's so many issues that they don't understand when you talk about time being counted and attendance that we have to do. And even on the safety issue, we provide safety for our children, so I don't know where a fingerprint scan is going to ensure safety, because you have people that scan that may be a sexual predator. So is the scan going to say, once we go to DHS, this person is a sexual predator, or will it not? So we all have families sometimes that have sexual predators. We don't know, and we are sending our kids to pick them up.
I would like to answer that question about what we want DHS to do.
Thank you.
There are two things DHS could do that would increase the funding for child care, and I think everybody agrees. The big challenge is to try to get more kids on the certificate program, because everybody's waiting lists are big. People aren't getting them right now. They're frozen. That's the reason that centers are having such a hard time financially. And there are two things DHS could do. DHS could quit redirecting child care money away from services to children, like this finger scanning financial commitment, like the contracts they're issuing for quality improvement that are so much more money than the federal regs require them to be spending on that. Secondly, they could put more of our state TANF money into child care. Both of those things wouldn't cost the state a penny. All it would do is redirect money that we've already got to childcare services to serve more children. That would be the biggest thing they could do to help.
Great, thank you.
I'd
Dolores
like-
Gray Sewell? All right.
Yes, I'd like to say one thing to add to that. I've always been talking to the public schools about a seamless approach. Why should we be working with the public schools? They're getting money. They're getting Title I money. So why should we not be working with the school in our area so that we can make sure that the children are ready? They have material that's warehoused in their storage room. So if we sat down and we worked and came up with a plan, I think that it may not be all about money, but we need to find it.
What's your position? You're the, I can't remember. It's
I'm
been,
the
been a few months.
president of the Childcare Directors Network. I also serve on the Health Department Advisory Council, and I'm the owner of Prep Company Tutorial Schools, and I do serve on the Jackson Chamber of Commerce.
And your name again? What was your name again?
Dolores Sewell.
At 3 o'clock yesterday afternoon, we received a response from Assistant Attorney General Earl Scales regarding implementation of this program prior to a public hearing. We asked for them to have Xerox to cease and desist until such time administrative procedures and this hearing had time to take place and they had been able to receive public comment. And I would like to let you know now that that was granted. Jill Dent has contacted Xerox Corporation, and they will not be making any further contact with you until further notice from her.